Hello everybody, Dr. Parsa Karimi. Today we're going to talk about wrist and hand pain, as well as the thumb and into the digits. Now, many people think that you have to go to an occupational therapist to get your wrist and hand taken care of if you have any kind of symptoms. But the truth is, physical therapists learn just as much about the hand as they learn about the ankle when they're in PT school. So, had a patient the other night came in. She watched one of our other videos about how to prevent knee replacement by going to physical therapy first. She happened to go to a doctor and told the doctor that she had some thumb pain. The doctor took some x-rays and said, oh my God, you have severe arthritis and we're going to have to do surgery, take out some bones and all this sort of stuff. Scared the hell out of her. So luckily she gave us a call. She came in and all she had was a couple of muscle spasms in and around her thumb and her wrist and her forearm. And that was mainly the cause of her pain. So this particular patient, I know it's around the holiday season. A lot of grandmas and moms out there are doing a lot of crocheting, a lot of knitting. So it's a constant repetitive movement. Even people that text a lot get this in their thumbs. But mostly this activity with knitting and crocheting can cause the muscles in your fingers and your thumbs to become more and more inflamed. Just like the video I made about people that all of a sudden they have a sedentary lifestyle, they don't move around a lot, and all of a sudden they go on a trip and they're doing a lot of walking, hiking, climbing, and then they start to develop knee pain or hip pain, and then the doctor tells them, oh, you have bone-on-bone arthritis, let's do surgery. Hold on a second, it's probably just muscle. Same thing with people right around the holidays. Maybe they're not doing a lot of knitting, but now they start getting requests. Hey, can you make me this pocketbook? Can you make me a sweater? Can you make me all these different sorts of things? So they start to do the knitting over and over again. And to us, you think, what more calming, soothing activity can you have than knitting? But if you're holding a pin and you're stabilizing it in one hand, as it was explained to me, and you're kind of doing the work with the other, and you're constantly using the one thumb to hold something down so it doesn't move, well, eventually you're going to strain the muscles in your thumb and in your wrist, which is exactly what happened here, luckily. So you have muscles here on the base of your thumb called the thenar eminence. The muscles attach literally from here right to the base of your thumb, and they allow for the movement of your thumb going around in a circle like this, reaching across to the other side, the opposable thumb. You also have the hypothenar eminence, which is here along the pinky, which also allows the thumb to be moved this way instead of just a straight going forward and back. So these muscles, when they become inflamed, they can give you a lot of thumb pain. You also have the tendon right here. You can see it. It's my flexor pollicis longus tendon. It goes to the tip of my thumb. It comes and attaches right here to the distal or the end of the radius on the dorsal side or on the back side of the forearm. And then if you flip it over, you have the ventral forearm, which is here. You have the anterior side of the forearm, the front side, and you have your flexor pollicis longus here, flexor pollicis longus. It goes through here, goes through the carpal tunnel, and it goes and attaches to the tip of the thumb and allows you to do this, flexing the thumb. So any kind of activity where you're going to use the thumb a lot, and you're going to be using a particular position of the thumb, and you're going to be holding it so you can hold an object to do like crocheting or knitting, you have the tendency and the likelihood and the chance to inflame these muscles here and then cause the pain in the thumb. And every time you try to move it, it causes a lot of pain. The diagnosis of arthritis in the thumb, I've seen it many times. It's the diagnosis patients come in with, but it's not at all what's causing their pain. Again, it's usually muscle. So if you get the diagnosis of, hey, it's arthritis, again, it goes back to what I was saying about the knee. Someone tells you, oh, you have bone on bone. The next logical answer to the question of, well, what do you do about that, is of course going to be a total knee replacement if the bone on bone is what is causing your pain. But many times I've seen it here, and I've been saying it for the last 20 years in practice. Many times, just because people have bone on bone, a subjective description of an x-ray in their knee, their hip, or whatever, doesn't mean that that is what's causing their pain. They could have had that arthritis for years. That's not at all what's wrong with their knee or causing their knee pain or their thumb pain. And that is what patients lead into the operating room with, thinking, well, I have bone on bone, I need to do surgery. And this person would have been in the operating room having surgery on her wrist and thumb. God knows what bones are being taken out. I don't know what that means. And what was going to happen to the wrist and hand, all because a couple of muscles here were inflamed. And we do massage, stretch, exercise, and we resolve the problem, and the person can go back to what they were doing. Sometimes the simplest answer is just that. They just did a little bit of overuse. They used a particular part of their body more than they were used to, particular season like knitting season and crocheting season around the holidays, and now they just inflamed themselves. It happens. But the most likely muscle, the most likely tissue that you're going to inflame is muscle. So let's go after that first, because that is the easiest thing to correct with massage, stretch, exercise. instead of jumping into the operating room where the tools used there are scalpels, retractors, and stitches. I mean, you always want to stay away from the most effective, most invasive form of treatment first. You want to go after the most effective and the least invasive form of treatment, which is physical therapy, because the most likely culprit in many of the reasons why people go and seek healthcare is muscle pain. So remember that next time you're out there, and if you're doing a lot of activities with your hands, wrists and hands, and you think you're aggravating it and you think you've overused it, what have you overused? What is more likely the thing that's going to happen? Is it more likely that the joint in your thumb is going to grind down so much because of knitting that literally all the cartilage wears away in a 65-year-old woman? Is that likely? Or is it that you use the muscles so much to do this one particular activity, something maybe you weren't doing your whole year, and now all of a sudden it's an uptake in how much you're doing this activity? Maybe you're just straining the muscles.